Let's walk you through the data. There were 29,892 new cases of the Delta variant identified in the last week. That means a total of 42,323 cases of the variant have now been reported. 90% of all new cases reported in the UK are now that Delta variant. And the latest risk assessment suggests that vaccines are 17% less effective after one dose. That is compared with the Kent variant. The Office for National Statistics estimates that 96,800 people in England had COVID-19 last week. That is up by over 10,000 from the week before. Well, our health correspondent Ashish Joshi joins me now from the newsroom. Ashish, this is pretty troublesome data, isn't it? Not just in the course of this pandemic, but also for the prospects of that great final unlock on the 21st of June.
Yes, this data comes just ahead of the weekend where the Prime Minister will be talking to his scientists and his other advisors and looking at all the figures presented to him before he tells the country effectively on Monday what's going to happen a week later on the 21st of June, the target that he has set himself for lifting all restrictions in his country. Now, we have to remember, Sam, that these numbers, the surge in cases driven by the Delta variant, is against the backdrop of the most incredible vaccination and immunization program ever undertaken in this country. So if this Delta variant is finding so many new people to infect every day while we have a vaccination program in place, then really that has to trouble the Prime Minister. And that's why there are so many scientists who are calling for a delay in this reopening of the country on the 21st of June. The argument to this, what people will say is, well, yes, we have a variant, people are becoming infected, but we aren't seeing hospitalizations spike in the same way. We're not seeing as many people fall very, very ill, and we're not seeing the number of people dying in the same way we were earlier. And that is the key argument. But then the argument, the counter argument to that, as it were, is that if you have more infections, you will have more people who will fall sick. You will have more people who need hospital treatments. And even if they're getting much better, much more quickly, they are still occupying bed space. And that still puts pressure on the NHS as it tries to recover to where it was before, tries to offer up more elective procedures, more operations, sees more patients. All of this just adds to the pressure that the NHS is already under. It's certainly something it doesn't need. It doesn't need a new variant driving a spike in infections and those infections leading to hospitalization. So a lot for the Prime Minister to consider.